Hello, my dear friends. Welcome to another episode of YAFI series. You asked for it, and Dr. Amit Lall this side. One of the common queries in recent days was the scope and prospects of the branch Pedodontics after MDS. Firstly, try to understand there is a myth that this branch is gender biased. Though we see around maximum girls going for pedodontics, boys are less. But ironically, the stalwarts in the department of pedodontics across the country are generally male. I'm not, no offense to anybody. My madam in my own college, she is principal now, Dr. Dimple ma'am. She is a pedodontist, legendary, great teacher in pedo. All due respect to everybody who is doing MDS in pedo and every other branch as well. But yes, there are many people, many boys in the previous generation who had been doing pedo in the past and have excelled in life. Even our own faculty at Dr. Lall's BDS-2-MDS app, Pedodontics, is taken by Dr. Vivek Gaurav, who is the leading practitioner of Dehradun. So it's not gender bias, that's a myth. That's what I wanted to say. But yes, there is a catch in this. One trait which a pedodontist must have is he or she should be madly in love with the kids. That is the only prerequisite to enter the department of pedodontics. Either you love the kids right now before entering, or you start falling in love with the kids from the age of say 1 year, 2 year till 14, 15 years, 16 years during the course of MDS. Karna to padega. If by any chance you are not very comfortable in treating kids, by now you must have had your postings in internship in the department of pedo and other departments, so you know your comfort level. And as such, we all know ourselves very well. Like I tell you personally, in my clinic, whenever a patient, kid patient, child patient, pedo patient walks in, right from that door, he opens up of the reception till the time the child is there in my chair, I have goosebumps. So Dr. Jasmine takes care of all the pedo patients in our clinic. Myself, I am like thoda sa afraid of kids rather, and that is how the balance works. Okay, so it is your call, but this is a major prerequisite. Now comes what all you will be learning. Pedo at times, once, like I read somewhere, it's not my quote, but yes, it's like doing the BDS again in a much better way, in much refined way. Like you will be doing conservative, you will be doing endodontics. I always believe a person who can, if he or she can do endo in a child, in a primary tooth and a permanent tooth, you can do endo anywhere. So you will be master in endo for sure. Then you will be doing extractions, you will be doing minor ortho, interceptive and all. Space maintenance, major forte of pedodontics, provided you are into that kind of practice, right? Then there is definitely the level of general anesthesia, conscious sedation, many other things. There is always a video, also a video with the legend Dr. Nikhil Srivastav sir, an eminent pedodontist in the country, one of the, you can say, the stalwarts, who even has a patent of a space maintainer appliance in his under his name, pass out from KGMU, BDS, MDS. So there is a video on YouTube you can watch for sure to know the actual scope, what pedo PG is doing in the college, right? But once you pass out, the catch becomes there. India is still, I don't know why, not ready for the branch called pedodontics. There is a bias towards the branch. There is, like you can say, other branches have some kind of superiority complex over the pedo. This is not my opinion. This is the general perception pan India amongst the dental fraternity. Sadly, because pedo as such is very tough to cope up with the, you can say, the actual workflow of the branch. Plus, a lot of things happen when you are dealing with child. You have to be super vigilant handling child patient. But catch here is like, the problem is, if you pass out and you are trying to settle down in tier 1 city, it becomes still, you can say, on an easy side. But if you are in tier 2, tier 3 city, then you should not promote yourself as an only pedodontist. You should promote yourself as a dentist who is very good in pedo, excellent in pedo, plus you are excellent, you are excellent in the actual fields of RCT, restorations. Maybe you learn implants as well, because implants is one thing which is totally out of the syllabus of pedodontics. You're not supposed to do implants as such before 16 years of age. So this is where the loophole comes into picture. But yes, if you want to excel in your own setup, in your own clinic, in any urban, semi-urban area also, you should go ahead with that and learn implants, learn some higher things in dentistry which you feel are creating a void in your branch. But in tier 1, you can easily start up your setup. Tier 2 also, you will be doing excellent work. Your clinic will run phenomenally very good. Okay, because you are the person who's trained in almost all branches of dentistry, apart from some, you can say, higher surgeries and all. Then there is always a talk about conscious sedation and anesthesia, but you have to remember, dear, like, these kind of cases don't come every day. Plus, not every child is indicated for GA. There are definitely complications associated with it. There had been some bad experiences in the past, some casualties. You can Google it up. I know, because in last 20 years, these were published in Times of India also. Okay, so it's not, you can say, a simple cup of tea that you can try it out without having actual training. You should be rigorously trained under to handle the anesthesia thing. You need to have a setup. You need to have an anesthesiologist standing next to you when you are doing such cases. So as such, you can always go for pedo if you want to settle down fast and start up your own clinic. That is the bottom line. But pedo, very, you can say, it's not a branch to, you can say, propagate, or you can say excel towards the consultation sites. They are very limited. In tier 1, definitely people usually will involve specialists like periodontist for some bigger procedures and all. But in tier 2, tier 3 city, if you are settling down, then it is a problem. Even in tier 1, the acceptance level is little on the low side. I hope this works fine. But yes, as such, the pedo, since it is a very highly clinical branch, so it always, you can say, has an edge. You always will have an edge over the counterparts in your non-clinical segment. Okay, thank you. Keep posting your queries. More than happy to come with a relevant answer. Have a great day.